And a little bit about our speaker today before I hand it off. Dr. Brett Robertson is an associate professor and mass communication sequence head with the College of Information and Communications at the University of South Carolina. He is also the associate director of the Hazards, Vulnerability, and Resilience Institute. So now I will pass it on to Brett.
Hey, good afternoon, everyone, or good morning, depending on where you're joining from today. It's a privilege to be here with you, with colleagues across Region 2 who work every day to strengthen preparedness. That really depends from health professionals, emergency managers, those who are on front lines in places like public libraries. You help ensure that reliable information reaches the public. And so your efforts are the backbone of community resilience. As April put it, my name is Dr. Brett Robertson. I'm an associate professor in the College of Information and Communication at the University of South Carolina and the associate director of the Hazards, Vulnerability, and Resilience Institute, also known as HAVRE. My research centers on disaster communication, which is how messages are designed, how trust is built, and how people decide to act, learning how people decide to act in the midst of uncertainty. And over the past several years, I've studied hazards like hurricanes, wildfires, pandemics, misinformation during emergencies. And while every hazard is different, a clear pattern emerges. We can have the most accurate forecasts, the strongest infrastructure put in place, and the best available resources. But if communication falters, if people don't trust the source, and people don't understand what's being asked of them, the entire system struggles. The reality is why today's session is called Communicating Across the Gap. Our focus is not just on the warnings that we send, but also the distance between data and action, between institution and communities, and between knowing the risk and being ready to respond. So before we dive in, I'm going to start with just kind of a quick poll. I'm going to put a question in the chat for folks. And so I want you to think about the last time that you saw some sort of emergency message, okay? Maybe it was a severe weather alert, a health advisory, or a boil water notice. What do you think most influences whether people act on that message? Is it the clarity of the instructions, the credibility of the messenger, or the perceived severity of the threat? Go ahead and drop your thoughts in the chat, and we'll circle back to these themes as we move through today's session. Just out of kind of skimming the chat right now, it seems that all over the board, the answer is quite different. So I think that'll lead us to have some really interesting conversations today. Now, with it being the month of September still in the United States, it is National Preparedness Month. I want to begin with something that hopefully is very familiar to you. It's an emergency supply kit. So we're going to do kind of just a quick check together. I want you to think about this on your own. And I'm going to go through a few items, okay? These are items that FEMA and the American Red Cross suggest that every individual in their household should have these items stocked and ready to go for at least 72 hours, okay? So think about your household. Do you have these items easily on hand, ready to go? Okay, so first is water. Do folks have extra water on hand? You can kind of answer this just mentally if you wish. Non-perishable food like canned goods. A battery-powered radio. a flashlight, and a working flashlight too. Sometimes I go through drawers in my house and find flashlights that don't turn on, or I don't even have the batteries anymore. And then a fully stocked first aid kit. I'm just guessing that some of you may have had a few of the items, but very few on this call probably had all 5. And these items, water, food, radio, a flashlight, first aid supplies, those are the basics. FEMA actually has a list of 15 items in total, but these items listed here are the basics. They're concrete, tangible steps that families and communities can take to prepare. And they matter. They give people a sense of readiness. Having emergency supplies on hand helps reduce uncertainty, and they support health and safety in these very initial critical hours of a disaster. But here's the bigger picture, especially as we end National Preparedness Month. Preparedness doesn't end with just an emergency supply kit or a go bag. Kits and go bags are great because they're a visible symbol of readiness, but true preparedness also includes planning, coordination, and clear communication. That's what helps move people not just through moments of crisis, but towards wellness on the other side of it. And that's where communication becomes so central, because no matter how ready we are with our supplies, our decisions in that moment still depend on the messages that we receive, whether they're trusted, whether they're clear, and whether they point to real actions. Which brings me to my next point. A warning is a spark, but not the whole strategy. Now, I want to pause on the idea of warnings. In almost every kind of disaster or hazard, our first instinct is to issue a warning. It's fast, it feels urgent, it signals something is coming. But here's the reality. A warning is not a strategy. It's a spark. And without the right fuel around it, that spark tends to die out very quickly. If we think about a boil water notice, an evacuation order, or an air quality alert, each of those can capture attention in the moment. But if the message isn't trusted, if the instructions aren't clear, or if people can't connect to it, to what they should actually do, then the warning alone doesn't move us very far. And that's the challenge we're here to tackle today, because issuing a warning is often the easiest part of a disaster plan. The harder and more important work is everything that comes after, coordinating across agencies, translating data into action, and earning the public's trust so that people want to act. So let me pause for a quick reflection. I have another question I'm going to put in the chat. So I'd like for you to think about the last emergency alert that you received. Maybe it was a weather alert, a health advisory, or even a boil water notice. Did you take action right away, or did you ignore that message? Go ahead and share your answer in the chat. Don't overthink it. I'm just curious people's first reactions. I'm seeing a lot of take action, which is good. We have someone who said wasn't pertinent to me, so I ignored it. Ignored, nothing I could do about it. We'll circle back to this idea today of why some warnings move us to act and why others don't. So hold on to this idea just a little bit. Now let's look at what happens when warnings don't translate into action. We've seen this across many different hazards. During heat waves, lives are lost when advisories, even when advisories are issued. I do a lot of work around excessive heat communication. Some of you may have participated in a session with me earlier this month where I focused specifically on the work I'm doing around extreme heat. In hurricanes, we also see that evacuation orders are ignored by a large percentage of the general public, despite repeated alerts. And in the pandemic, we saw kind of misinformation often drowned out really clear public health guidance. Different hazards, but the same outcome. The message was sent, but people chose not to follow the behavior. The common thread here really is a breakdown between concepts that we call in the literature risk perception and risk behavior. In other words, people may see the warning, but they don't always believe it, or they don't even know how to act on it. And when trust is low or guidance feels impractical, people just start to default to apathy or inaction. And so this raises a really critical question for us as those who study disaster and risk communication. How do we bridge that gap between what people hear and what people do? That's the challenge that this session is really focusing on today. And so think about this question. We don't have to write it in the chat, but why do people ignore emergency messages? Do they not believe them? Do they not understand it? Or do they think they can't do anything about it? Research shows that all three of those, they don't believe it, they don't understand, or they don't think they can do anything about it, matter. But there is one that comes up most consistently, and that is people's sense of control or lack thereof. If people don't feel like they can actually do anything in response to the warning, they often tune it out, even if they believe the threat is real and they understand the message. And so that's why pairing risk information with clear, doable actions is so important. It can restore a sense of agency, and that's what turns awareness into behavior. To make sense of these challenges, I want to share a simple framework that guides a lot of my work, especially as it relates to trying to better understand and create disaster plans. And a lot of my work is built around the theoretical ideas of these three phases: preparedness, warning, and wellness. And so preparedness is everything we do before a hazard or crisis. It's the outreach, the education, the community engagement, the planning. This is where trust is built, or mistrust can take root if communication is inconsistent. Warning is the moment of contact. That is the alert, the advisory, the push notification on one's smartphone that signals danger. These moments are short, but they're powerful. If messages are clear and credible, they spark action, or they have potential to. If not, they fade quickly. And then wellness is the outcome that we're aiming for. It's not just for survival, but it's for stability, health, and the ability for communities to recover and move forward. But here's the most important part. I argue that communication strategy moderates every transition. So from preparedness to warning, communication determines whether people recognize a hazard is coming and whether they trust the source. And then from warning to wellness, communication determines whether people act and whether they have the resources to follow through. So I don't want people to think that communication is just something of a side task or something that you can just hire a person to be the comms lead. It isn't just an add-on or writing a press release. I argue that communication is infrastructure in hazard events. It's essential as roads, shelters, or clinics. And when we strengthen communication, we strengthen the entire system. And one thing that disasters do, whether it's a hurricane, flood, wildfire, pandemic, is they expose the weak points in our system. They act like stress tests, showing us where infrastructure and communication hold and where they break. And I want you to think about how interconnected these systems are, especially in the US. So when the power grid fails, hospitals struggle to keep equipment running. And when transportation systems stall, people can't reach shelters or clinics. When communication networks are down or inconsistent, confusion spreads faster than reliable information. None of these issues stand alone. They ripple across one another. And the impact isn't felt evenly. Some neighborhoods and communities have access to stronger healthcare, reliable transit, or local trusted leaders. And then others don't. And that just makes the gap become painfully more visible during a crisis. That's why communication can't just be about pushing out warnings. Communication has to recognize these underlying vulnerabilities and meet people where they are. If trust is low, if access is not equal, or if systems are not coordinated, the best warnings won't help us prevent harm. Now, when disasters hit, no single system carries that load on its own. So if you think about hospitals, emergency management organizations, schools, local government, the media, they all play a role in keeping people safe during hazards. But here's the challenge. When these systems aren't aligned, the public can feel it immediately. So a school district issues one message while city officials issue another. A hospital hotline has outdated information that conflicts with what local TV news is reporting. Those misalignments don't cause confusion, they delay action. And in a crisis, that lost time can mean losing lives. In some of the research that I've done around Hurricane Harvey, which hit Houston, Texas, the greater Houston, Texas region in 2017, one of the things we found were that neighboring counties that the same city resided in, these two different counties had different telecommunication systems. And even though they were trying to operate the same goals within the city limits that they were in, they couldn't communicate to each other because they had different proprietary systems. And so even communication within the same sector can also break down. Now, communication has to occur really well across sectors and inside the same sector. It's essential. When agencies coordinate their messages, they create clarity. But when they don't, they can create noise or duplicate efforts being done. And clarity is what enables the public to act quickly and confidently. So let's think about a real, like, hypothetical scenario here. We're still in Atlantic hurricane season, and imagine you're the hospital director during a hurricane evacuation. The county issues an evacuation order, but schools announce that they'll stay open one more day. The media is reporting both without context. What happens next? For families, for the staff, or for the trust that public has in these institutions. This kind of breakdown isn't hypothetical. Obviously, what I just posed was an extreme example, but it's something we've all seen at different levels. And it's exactly what cross-sector communication is designed to prevent. This is where the gap really shows, because even when we send out warnings and we get warnings from different sources, they do not always land in the way that we expect them to. First, there's message fatigue. I think today people are flooded with alerts, especially on mobile devices like smartphones. We have weather, traffic, school closing, public safety, even subscription notifications. I have several text messages just during this presentation that I've received. When everything buzzes with the same urgency, it becomes harder for people to prioritize what matters most. And sometimes when we receive so much, we just stop noticing altogether. Second, there's unclear guidance. A message that says air quality alert issued sounds really important, but without the specific actions attached to it, it's easy to swipe and move away from it. If people don't know what that alert means for them in the moment, it loses all its power. Third, we often face conflicting voices, like in the hypothetical example on the last slide. One agency says one thing, another says something slightly different, and then the public is left to figure out who to trust. And these mixed signals slow down decision-making and erode confidence. And then finally, there's the problem of data without decisions. We can share numbers, case counts, forecast models, air quality levels, but if people can't connect to those numbers, especially if they can't figure out what they should do, then the message isn't going to change their behavior. Think about it in practice. An outdoor worker gets a heat alert, but they can't feel like they're able to stop their shift. A parent sees an air quality warning, but wonders if it's safe for their child to walk home from school. And a community may see rising COVID or flu cases, but they're not sure what that means for their daily routines. When messages are unclear, untrusted, or disconnected from our real life conditions, people continue to stay at risk. And those small disconnects, however small they seem in the moment, can add up to serious outcomes. And that's why the question isn't just how often we warn, it's how well we connect to other people. Now, when people see a warning, they still face another challenge. The numbers itself on the warning do not mean a lot without context. So take, for example, flooding. A forecast might say the river will crest at 22 feet. For most people, that's really abstract. But if you say at 22 feet, your street will flood, suddenly that number has a lot more meaning to it. Or consider air quality. An AQI of 150 doesn't tell the average person what to do. But if we translate it into action, stay inside and run an air quality filter, if you have one, that number becomes really useful. The same is true for vaccination rates. We can report percentages, but unless people understand what that means for their community, their family, and their risk, the numbers do not carry weight. And this is the heart of the issue. Metrics don't drive behavior, but meaning does. Translation is what builds both trust and clarity. If people can connect to a statistic and make it be perceived to their own reality, they're more likely to act on the issue. So how do we move from numbers and alerts to real behavioral change? The answer is we have to make the data actionable. And that starts with plain language. We have to avoid jargon. We need to give people the what, the when, and the why. So instead of saying air quality alert in effect, you could say the air quality is unhealthy this afternoon. Limit outdoor time, especially for children and older adults. Now this turns a number into a choice. Second, we need to connect people to resources. Don't just say evacuation recommended. Tell people where shelters are, how to get there, and who to call for transportation. Third, we have to tailor messages to the setting. A school needs different guidance than a hospital. A worker and an outdoor worker needs something very different than someone who drives in kind of a gig employment like Uber or Lyft. A workplace needs something very different than advice that's given to a community clinic. It's the context that shapes what's possible. Then finally, partner with trusted messengers. In some communities, that might be faith leaders. In others, it's local radio. It could be the frontline nurses or hospital staff. It could even be a community champion or a neighborhood organizer. The message sticks if it comes from someone that people in their community already trust. And so the hardest part of turning data into action might be very different from person to person. For some people, the challenge might be writing clear guidance. The challenge for others might be connecting people to the right resources. Sometimes it's hard to find who that trusted messenger is if you're not embedded in the community. And so we'll frame strategies and dig into how to reach some of these at-risk groups. And I think one of the hardest truths about disaster and risk communication is that the people who are at most risk are often the least likely to receive or act on a message. Think about it. Unhoused populations may never see a push notification or an alert because they don't have reliable phones or internet access. That's a hypothetical. There might be language or literacy barriers that make alerts hard to understand when they're filled with jargon or even just small print. And then for some, the mistrust of institutions based on past experiences of being overlooked and misled often mean that official messages could carry little weight. This isn't just a communication challenge, it's a challenge about making the access of information available to all and with the right clarity. Because if our messages only work for the people who are already connected and comfortable, we're not reducing risk, we're just shifting it on to the ones who are already the most vulnerable. So what do we do about it? The answer is to extend communication beyond the digital. This means going back to some old school measures like signage in bus stations and shelters, having flyers distributed in multiple languages, or working through local partners who already have those relationships with hard to reach groups. In some of the work that I'm doing in rural communities in South Carolina, we're partnering with our Department of Public Health, who are helping us learn who is in these communities. And those folks already have relationships with these partners at our public health office. The lesson here is simple but powerful. If we want to reduce harm, we have to design messages for the people least likely to hear them, not for the people most likely to. So if we think about in our various communities here, who is most at risk of missing your messages? I want you just to think about that question, not posing it in the chat, but think about in your community, who is likely to miss these emergency messages? And what are ways that you might choose now to reach them differently? We'll keep building on that thought as we continue onward. So let's say we've solved the reach problem. We found a way to put a message in front of someone, regardless of their phone access, their reading ability, or their level of trust in institutions. This still leaves us with a critical question. Do they act on it? And a lot of social science theories give us a simple but powerful way to answer that. And people's decisions are often hinging on three core beliefs. The first is attitude. Do I think this is serious? And if someone doesn't believe the risk applies to them, they're less likely to take it seriously. Second are social norms. Are others in my community doing something? If my neighbors are staying put during an evacuation, then maybe I choose not to leave. If I see my coworkers ignoring this emergency alert, it would become weird to be the outlier who speaks up and does something about it because we still have a sense of peer pressure. Third, control. Can I do anything about it? If people feel powerless, their options are limited, or they recognize no matter what they do, their changes won't matter, they're less likely to act altogether, even if they know they're in danger. So that's why message clarity and relevance matter so much. A good message does three things. It shows urgency without causing panic. It demonstrates that others are acting, which normalizes the behavior. And it provides clear, doable steps that restore a sense of control. So when we frame communication this way, we're not just sending messages, we're designing choices. Choices that feel possible, urgent, and that people can see themselves carrying out. Now, before we turn to additional recommendations for trust and preparedness, I want to pause to talk about what I think is like the important takeaway of a lot of the work that I'm doing and that I've embedded in this presentation is that communication is infrastructure, especially as it relates to hazards and disasters. It's not a side task or an afterthought or something we wish we would have done better. It's just as essential as the roads that carry people to shelters or the hospitals that provide care once they arrive. Communication is the system that links all these services and everything together. It's how emergency services connect to hospitals. It's how local government connects to schools. It's how the public connects with resources and makes choices in the moment that they need them most. And like physical infrastructure, communication doesn't just maintain itself. Communication has to be built with intention. It has to be tested through drills and real world feedback. And it has to be maintained with resources, staffing, and ongoing improvement. When we invest in communication this way as something foundational, not optional, or just something we can put in a disaster playbook and let it sit idle and dusty for a while, that's not helpful. We need communication to be foundational so it allows us to build trust, create clarity, and speed up every part of the response. So keep that in mind. Every dollar, every hour, every effort spent on disaster communication has the ability to strengthen the entire system. So let's talk about some really practical strategies, things that communicators, that planners, that public health professionals can start applying right away. First, build trust. That means being consistent, transparent, and culturally relevant. If people see you as a reliable source before a crisis, they're more likely to listen to you when the crisis arrives. Second, coordinate across sectors. Do not wait until the emergency to align your messages. Have shared templates, pre-scripted alerts, and common language across these sectors like hospitals, schools, and government agencies, because that helps prevent confusion and speed up responses. Third, overcome barriers. That means planning for literacy deficiencies, addressing information that isn't accurate, and closing digital divides. The more we anticipate these barriers, the fewer people that fall through the cracks. And then fourth, encourage emergency preparedness. That's not just telling people they need to get ready. It's about making preparedness real through creating an emergency supply kit, like we talked about at the beginning, through participating in drills, early outreach, and partnerships with communities that already trust. These four strategies, trust, coordination, barrier reduction, and preparedness, are the building blocks of communication that actually save lives. So our work all really depends on these different factors, but for some of you, one of these four strategies might feel more urgent in your communities. And so it's about surfacing and knowing where these pressure points are in the communities that you serve. And so as I kind of wrap up this big picture talk today to talk more about how we bridge that communication gap, I said at the beginning that warnings alone are not enough. And everything we've discussed today really confirms that. We know that warnings spark awareness, but without trust, clarity, and coordination, they rarely spark action. The opportunity is this. We don't have to wait for the next disaster to change that. We can strengthen our communication right now in the way we prepare communities, in the way we align our institutions, and the way that we design messages that people act on. That's what this framework is all about. Preparedness to warning to wellness. In the preparedness phase, communication builds trust and sets expectations. In the warning phase, communication makes risk clear and actions doable. And in the wellness phase, communication reflects whether the strategies worked, whether people were protected and communities could recover. So if there's one idea that I want to leave you with in this talk, it's that communication is the bridge between risk and resilience. And when we invest our dollars, our efforts, our time in that bridge by making our messages clear, coordinated, and trusted, we don't just improve awareness, we improve outcomes and save lives. And so I just again want to thank you for all of the work that you do every day to strengthen preparedness and public health across Region 2. And my hope today is that this session has given you not only ideas, but also practical strategies that you can use in your role, whether it's building trust, coordinating across sectors, or making sure warnings connect with the people who need them most. If there's one message I want to leave you with, it's this. Communication is infrastructure. It's not just about what we say, it's how we build readiness, reduce harm, and connect people to safety when it matters most. And I'd love to continue the conversation with you beyond today. The QR code has my contact information. Please feel free to reach out. I would love to work with you or chat with you, whether it's to collaborate, brainstorm, or share what's going on in your own community. Because I hope we can continue to talk about how to bridge this gap between warning and action and between risk and resilience. So I look forward to staying on the call for some questions. And again, please feel free to stay connected with me beyond today. Thank you again.
Thank you, Brett. Anyone that has questions, please drop them in the chat or use the raise hand feature, which you can find on the React button.
Yeah, hi, this is Janice from Minnesota. I'm just curious about public misinformation. How do we win back the trust? I mean, misinformation about health information continues daily. I think we're all quite aware. How do we win back that public trust and counter the misinformation?
Hey, thank you for that question. I don't think we have a really clear-cut answer for how we navigate that today because unfortunately, if technology evolving so quickly and so many new ways of communication are taking place, it's really hard for folks to keep up. And I'm thinking about the advent of artificial intelligence and machine learning today and how we navigate the kind of user-generated content experience that now everyone can be an influencer. And regardless of if you have the credentials, the expertise, the education, you're able to amplify your message regardless of that credibility. And so I think we really have to think kind of old school on credibility a fair bit. And it's hard to do when platforms and technology are moving so quickly and we're inundated with so much information. But I think the best way that I've dealt with some of this is, again, to locate some of these community champions who are kind of seen as the credible figure in a community. And I start at the really micro level too. I think one of the things that I found in the work that I'm doing in rural South Carolina is that the trusted government officials are actually not so trusted in one community. But the people that are often kind of looked upon for advice are the religious or spiritual leaders in the community. Or they're the business community who owns restaurants and shops or things like that. And so I think as we kind of approach strategies to communicate hazard information, people are going to look to others in their own community who they see as similar to them, who are taking action in some way that seems reasonable or tangible to others. And then the other is, I think, you know, really focusing on how to showcase information in ways that reach those specific community members. So I know some people now call social media old school. People sometimes look down upon Facebook, but I argue that local community Facebook groups often harness information that people use actionably as compared to, just kind of public social media platforms, for example. So locating, where people in communities are actually following and going through information, I think is really key and one strategy to prevent the influx of misinformation.
All right, there's another question in the chat from Micah. He said, that was informative. Thank you. Would you say you use some of these tips in other non-urgent communications?
Absolutely. I think they can be used in a variety of different contexts too. I think obviously like the onset of a disaster or hazard comes across as really urgent, but learning about risk perception before a hazard strikes is often the key to making actionable change. So right now in South Carolina where I live, we're wrapping up what we call heat season. Okay, so South Carolina is really hot and humid for a large portion of the year, especially in the summer months. So we're learning about people's perceptions of extreme heat around this context, but now we're developing the messaging strategy so that way we can prepare for the next heat season in 2026. So we're spending time using the data that we have now and then building upon it to have an actionable plan ready to go for the next year. It doesn't seem as urgent as dealing with, kind of a quick hit disaster event, but spending the time and being methodical about planning in our words is really key here too.
Great. Another question in the chat. They said, we need a communication asset map in our rural community. Do you have advice on compiling all the communication channels?
Especially in rural communities, I think the best advice that I think is really a researcher and oftentimes an outsider who's going into communities and learning about them is I have to immerse myself in the community and I have to spend time there getting to know people. That's just not something you can just make a quick cold call and try to get some information about. I had to put my feet on the ground several times in a year in order for me to learn about some of the communities that I'm studying. And that's not even collecting data to do research. That's just getting to know people and showing up at Chamber of Commerce events or Rotary Club or speaking at the satellite university campus and giving public talks so that people in the community recognize me, not as an outsider, but as someone who has invested their time and wants to see the community flourish regardless of a hazard or disaster. And so in rural communities, that kind of immersion from an outsider perspective is really key because the communication channels that are used are often quite different than urban communities. Some rural communities still don't have access to high-speed internet in the US. In one community that I'm working in, they just got internet access like in 2025. So I think we have to be cognizant that some of the communication channels that people are using are varied. Sometimes public radio is seen as really reliable, or FM radio. FM radio and talk radio could be considered the news in the community. That's something I learned about a community I'm studying, but I would not have known that had I not been immersed and being in that community and learning about where people get their information from. So I think I don't have advice on compiling all the communication channels, because it's going to be quite different from community to community.
Hey, it's not really a question, but just to um, piggyback off of what you said before about the local news and using Facebook and stuff like that. Definitely where I am, just as an example, on Johns Island in South Carolina. There's always traffic leaving the island, and I will always check the Johns Island Unfiltered page on Facebook to see if there's a wreck or what has happened, because I will get that notification and that news so much faster than like if I turned on the TV for the news. So I definitely, to piggyback off you, I would highly recommend to look that up in your local areas for sure.
That's such a good point, because um, I find that a lot of people really truly rely on these localized resources for the best information, whether that's like the small neighborhood Facebook group, or whether it's, the TV channel, the local news outlet that everyone watches, that one market that everyone kind of pays more attention to or has the credibility. One of the things that I found in another study is that people really rely on their local meteorologist. Their local meteorologist is someone that is often seen as very trusted or credible. And in talking with emergency managers and public health professionals in the community, when I asked folks in a different study where people got their weather information from and how they made decisions about their workplace, a lot of people said they rely on what their local meteorologist said at the 6 o'clock news in the morning, which, that's great, but definitely we want to make sure we rely on official sources too, from agencies like the National Weather Service, who are kind of experts in that area too. Just relying on television news is great, and it's one step, and it can be seen as very trusted, but we want to make sure we're kind of gathering a whole arsenal of available information to us to make the right decisions for our workplace or for our communities.
I do have a question. Brett, could you provide any strategies for talking to communities about the weather, specifically folks who might not trust accurate weather due to misinformation around climate change that are natural or even man-made?
One of the best strategies I have to kind of get people in the mindset, especially if they've lived in that community for a while, is starting with kind of an opening story question. So, for example, you might say, okay, so you've lived in this community now for over 50 years. How has the weather been different from when you grew up to today? What was the weather like 50 years ago? Were you experiencing these kinds of conditions that we're having today? And I think if you frame it as a story, and if you frame it really as the weather, and maybe not necessarily about climate, and you give people the opportunity to, one, talk about themselves and talk about a story, or kind of extended monologue about how they've seen the weather change, they're more likely to get invested in some of the conversations later about, climate adaptation strategies. That's not necessarily something I can say. I can't necessarily say, tell me about some of these adaptation strategies that you've used over 50 years. That's not going to resonate with somebody. But if I talk about, okay, so, what did your parents do 50 years ago when you had these conditions? And did you open windows, or did you line dry your clothes? What were you doing then that's quite different than now? And so when you give people a chance to relate to themselves and find personal relevance and tell a story, especially about the weather, people always have stories about the weather. There's sometimes always one singular weather event that sticks with people, whether it's a 100-year flood, or the big hurricane in the last several decades or something. There's always something that uh, uh, kind of a catastrophic disaster or hazard that people latch onto, but people will always remember that. But when you talk about incremental and small weather changes, especially as they relate to climate, giving people a chance to reflect on their lifespan can be really fun and interesting too.
Great. Thank you, Brett. Okay, we have 5 minutes till 2, so I am going to go ahead and do the wrap up.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel or select a video thumbnail to watch another video from the channel.